Have you ever wondered why some people feel compelled to check if the door is locked multiple times, or why they must arrange items in a certain way? It's not just a quirky habit or a minor annoyance. It's a glimpse into the world of obsessive-compulsive disorder, often referred to as OCD. Obsessive-compulsive disorder is like a glitch in the brain's information processing system. Picture the brain as a supercomputer. In a well-functioning system, there's a smooth flow of data, with inputs being processed and outputs being generated. In the brain of someone with OCD, this process gets stuck in a loop, like a scratched record skipping and repeating the same part over and over again. This disorder manifests as obsessions and compulsions. Obsessions are intrusive thoughts that cause unease, apprehension, fear, or worry. Compulsions, on the other hand, are behaviors an individual engages in to attempt to get rid of the obsessions and reduce their distress. Imagine having a thought stuck in your mind that you can't shake off, like a song on repeat, except that this song generates immense anxiety. To stop the song, you engage in a ritual, maybe tapping a surface a certain number of times, or checking the stove repeatedly to make sure it's off. You know it's irrational, but you can't help it. That's the reality for someone dealing with OCD. But let's not forget, OCD is not a one-size-fits-all disorder. The obsessions and compulsions can take many forms and vary greatly from person to person. Some might obsess over cleanliness and order, while others might have intrusive thoughts about harm coming to themselves or their loved ones. The compulsions can be equally diverse, from hand-washing and cleaning to arranging and counting. So, what are the key points to remember about obsessive-compulsive disorder? First, OCD is a disorder of the brain's processing system, causing it to get stuck in a loop of obsessions and compulsions. Second, these obsessions are intrusive thoughts that cause distress, and compulsions are the behaviors that individuals with OCD use to try to alleviate that distress. Third, the manifestations of OCD can vary greatly from person to person, both in terms of the obsessions and the compulsions. And finally, it's crucial to understand that OCD is not a choice. It's not a matter of just shaking off the thoughts or stopping the behaviors. It's a serious mental health condition that requires understanding, compassion, and appropriate treatment. In the end, the more we understand about obsessive-compulsive disorder, the better equipped we are to support those who live with it every day. So let's continue to learn, empathize, and advocate for mental health awareness, because every mind matters.